The three areas I think that in testis cancer which were really important on the podium, one is the issue about stage 2 seminomas, which I looked at. The second area was increasing data on micro-RNA. There wasn't a specific paper presented here on new data, but there was an excellent overview by Robert Hamilton from Canada, looking at the value of micro-RNA and suggesting it's a very promising new development that needs to be taken into further larger prospective studies, and those studies are now underway. And the third area which is of interest is in non-seminoma high-risk disease. There is a debate about using surveillance versus adjuvant chemotherapy. And adjuvant chemotherapy has been a very successful treatment for reducing the risk of recurrence, and about 1 or 2% of patients only get a recurrence after that treatment. One of the concerns has been that if you had adjuvant chemotherapy and you relapse, that you may then be refractory to further treatment. And there was a paper presented on behalf of the global germ cell group that looked at it from the multi-center experience. It doesn't happen very often, so it needed, I think it was like 18 centers contributed a total of 50 patients. But what they showed was that actually the long-term control rate and cure rate from salvage treatment in that situation was very good, with an 80% disease-free survival rate, despite being a highly selected, negatively selected group of patients. So suggesting that if you do have adjuvant chemotherapy and have a relapsed, patients on the whole can be salvaged quite successfully by standard chemotherapy, perhaps introducing new drugs.